Hi, my name is Melissa. I'm a psychiatric nurse practitioner student. I'm in my final semester. I have been with Psychiatric Wellness for the last 2 semesters and now a 3rd semester. So I just wanted to share a little bit about what it's like to be a student with Psychiatric Wellness. Myself and several other students, we meet 1 day a week. Right now it's on Mondays. And then on other days during the week, we attend clinical and see patients face to face. So on our learning day, there's a schedule written out with all of the itinerary for the day, our learning objectives for the day. It's going to include, some learning about, integrative medications, integrative nutrition. You're going to learn about different types of therapeutic modalities, even learning about group therapy. You're going to be learning a lot about the integrative side of psychiatric practice. It's extra learning. It's a little extra effort if being a student in that regard when you decide to be a student with Psychiatric Wellness. But it's invaluable what you will learn there. And you'll be a better provider for learning it. And the extra effort that you put into it will pay off in the end for you because you're going to be able to take care of your patients from such a holistic perspective, which I love. So we get to practice doing integrative assessments with each other and making treatment plans and practicing different therapeutic techniques amongst each other. It's a really great way for us also, to bond as students, and I'm sure we'll probably continue to stay in touch even after we graduate and be resources for each other in the future. So great camaraderie there. The nurse practitioners are so wonderful at this practice. They're really patient with the students and they want to help you learn. I hear nothing but wonderful things from the patients about the nurse practitioners here. I feel like they really try to help you meet the objectives with your program. They really try to make a really strong effort and very supportive to help you meet your goals as far as like clinical hours. If you're needing therapy hours, you're going to get therapy hours there because they practice a lot of therapeutic techniques in addition to medication management. The providers there, they do EMDR with their patients, which is really wonderful because a lot of students don't have an opportunity to see that. So you're going to learn resourcing techniques and be able to practice those amongst, with all of the students there and with the patients. All of the things that you're learning and you're practicing, you're going to also be doing that with the patients in, the clinical setting with your preceptor. So, they do comprehensive lab work there with the patients. If they're going to be looking at, nutritional deficiencies, do we need to do supplements to raise, maybe their vitamin D level is low or their vitamin, their B12, those things can definitely, cause psychiatric symptoms if they're low. So supplementing those things can be a good strategy. They also offer gene site testing. So if you have patients that are on psychotherapeutics, it's going to help you know which psychotherapeutics they may be more responsive to. So that's a great addition to it. They do really comprehensive integrative assessments on their patients. And by the time you get done with that assessment, you really know your patient. So it's going to help you give like that holistic whole person view of your patient, and really help you know where to hone in, where you can start to help improve their mental health. And sometimes that doesn't always require psychotherapeutics. Sometimes that's just, therapy, and we need to make some lifestyle changes. You're giving recommendations on that, and you're recommending some supplements or ordering, certain supplements, and, patients can have symptom improvement with those things, So it's been a really wonderful experience. The extra effort of being, in the learning days, the things that you're putting in as a student to learn the integrative side of things, it's going to come back tenfold to you and make you a better provider. And I'm so fortunate for the opportunity that I've had to learn from Elizabeth and her team at Psychiatric Wellness.